everyone, I'm Louise and my vlog today is with regards to mental health. So from the 1st of April until the 30th of April this month, it is Stress Awareness Month. Now there are a few nurses, doctors, consultants and charities all working together to highlight the impact that stress does have on a person's mental health. Now, I do have some mental health issues that I'm not always open about. The reason being for that is I feel that I get judged enough as it is with regards to having a chronic illness and having a stoma. I am very much a person who seems to think that she's invincible. I tend to bury my head in the sand a lot and try to continue with life and get on as per normal. I hate taking medication. I hate taking tablets. For any of you that have followed me for a very long time, I do have a severe hate for taking medication as a general whole. Now, for me, with my mental health, I suffer with PTSD. I was diagnosed with post-traumatic stress disorder in the January of 2010. It took me nearly 4 years to get that under control, and for me now it is very rare for me to have a PTSD attack, but I did go for CBT, which is cognitive behavioural therapy, which is meant to help you rewire your brain and find coping mechanisms to dealing with that side of my mental health. Now, I have dealt with that. I still occasionally suffer with night terrors, and I always keep a piece of paper or a diary beside my bed and planning. I also listen to ASMR stories to help me sleep. The reason being is when I lay down overnight time, my body wants to go to sleep, but my brain does not. So you may have noticed that I'm looking a bit rough and a little bit frayed around the edges today. The reason being for that is I think this to me is what mental health looks like. This is me when I am at my worst. My anxiety and the anxieties that I have, the anxiety issues as I call them, are more so based on stress. So I've been flaring since January of this year with my illness, with my Crohn's disease, and it's taken a long time to get that confirmed. I'm now in isolation for 12 weeks or until the coronavirus disappears. The reason being for that is I'm having a Crohn's flare, so that makes me high risk, and I'm also been put back on some of my medications, which makes me an even higher risk. So I am now working from home. I took a brave step last week and spoke with my GP, and I have been put back on tablets for my mental health. The reason being my anxiety presents in different ways. So I'm rather particular and compulsive about things. I'm very can get very moody. I don't like talking about things. If I am stressed, I bottle it all up. This is probably half the reason why my flare is as bad as what it is. So I've now been put on I've been put on propranolol to help me with that. Now, things with stress are difficult and it can be hard. The reason being is for most of us, some sort of increase in stress levels is normal and can help us to be more productive with our day. So the stress symptoms that people have, some of them could be feeling overwhelmed, irritable, overtired. So you're overtired and you're not sleeping, or you're sleeping too much. There's other things as well, so that can be things like feeling constantly worried and anxious or scared, a lack of self-confidence, so always doubting yourself and double thinking things. You may avoid things or people that you are having problems with, and somebody's just put me in a cup of tea. You may be eating more or less than normal, or in my case, I was smoking more than I normally smoke. Now, for everyone with the coronavirus outbreak at the moment, I think it is highlighting just how stressful our days can be and how much of an impact stress can have on our lives. Now, there are things that I do to sort of alleviate the stress. One of those would be taking my medication and asking for help. Now, there is never any shame in asking for help. I do have to admit I had a bit of a breakdown and cried my eyes out before ringing the GP and asking to be put back on my medication. The reason being for that is my stress presents as not sleeping. So the last sort of 6 or 7 months I've probably been maybe averaging 3 or 4 hours sleep a night, working 12-hour days and coming straight in from work and crashing out asleep, which isn't healthy for me and it's not healthy for my family either. Now, some of the things that I did learn within my CBT training and some of the things that I did put up on a blog post are that there are things that you can do to help alleviate your stress levels. So for some things that may be being more active, so maybe going out for a walk or doing some exercise. There are things like meditation. My friends have recommended that I do meditation. I don't know how I feel about that because I'm quite analytical with things. You can challenge unhelpful thoughts or emotions, and what I typically do for that is I write things down and I try and find either a constructive way or a positive constructive way to help, or a positive emotion to help with that. I split up big tasks, so I don't know where it is at the moment. I think it's shoved down the side of the bed because the office is my bedroom at the moment, so I'm working between sleeping and watching Nashville. Split up big tasks, so I always have a task list for certain days and I tick those off as I go along. I also plan ahead and I write things down as to what I'm going to do. And the other thing is to actually allow yourself some positivity in life. So that's sitting down and thinking of maybe 2 or 3 things that can help you to impact those negative thoughts. Now, for me, with my stress-related anxiety, I'm always very over analytical and I pull things apart. It's part of the reason why I don't sleep over night time, because I lay in bed pulling my day apart and trying to think of what I could have done to be better, or what I can do to be more helpful, or what I can do to be a better person. Now, for those of you that are worried and for those of you that feel that you are being impacted by stress at the moment, especially with the everyone being isolated and being homebound at the moment, please try and maintain digital connections with people. So I have a family messenger group for my side of the family. I have a WhatsApp messenger group for my partner's side of the family. We do weekly check-ins with our friends. So we do WhatsApp video calls and FaceTime, Skype, even Zoom. Also other things, finding tasks to keep you occupied. So I do things like, I'm watching Nashville at the moment, which I'm finding quite nice and gritty, or even doing a puzzle or some colouring in. For those of you that feel that you are worried about your mental health, and if you feel that you do need help, please ring your GP. If you are already under a mental health team, then please do call them to help. There are so many charities that can help you. There is a previous blog post that I have written, so I will dig that out and I will repost that up, because that does actually have all the helpline numbers on that will split into age group and gender group and mental health issues for you to be able to ring those people. Don't ever be afraid to ask for help. It's always better to ask for help. It's not admitting defeat, it is just getting you the help that you need. So I will be back with another vlog soon. I'd like to say thank you ever so much for watching, and I'll be back with another video soon. So thank you, goodbye.